Prior to any MRI-guided breast interventional procedure, you will need to allow time to meet with the patient. Is the patient meeting really necessary? Well, yes. First of all, it is a JCO requirement. More importantly, however, having your patient informed will make them more comfortable with the procedure and in turn enable them to cooperate with your instructions. This will give you added assurance of a successful procedure. Explain to them what has occurred to this point by summarizing their clinical, mammographic, and ultrasound findings, as well as ultimately how MRI has contributed to their case. Consider reviewing their MRI images along with them, giving them an example of a normal and an abnormal case as a reference point. Make sure the patient knows why you are proceeding with an MRI-guided localization as opposed to a more standard mammographic or ultrasound-guided localization. Explain how the abnormality can be best visualized by MRI. The procedure will be somewhat familiar to the patient as all of them would have had a diagnostic MRI prior to this exam. Let them know primarily how this procedure will differ from their first MRI. Most notably will be the use of a moderate degree of compression. Explain how the compression will help to immobilize their breast and also explain why this is so critical. We explain to our patients that the whole procedure assumes that nothing moves from the first scan to the last. We do not want to be placing a needle where the lesion used to be. We stress that should they feel the breast has moved, possibly due to a sneeze or a muscle twitch, please let us know if we have not already seen it. We can likely replan the procedure rather than proceed and miss the lesion. The primary concern of the patient will be what kind of pain they can expect. Let them know what to expect. Most of our patients give us a 2 out of 10 on the pain scale, often with the initial xylocaine administration being the worst pain. If a vacuum biopsy is planned, we tell them that they will likely feel a tug or pinching with the biopsy. We let them know that we will tell them how many biopsy samples we will be obtaining, and we assure them that if they are having significant pain, we will further anesthetize the breast tissue as needed. We also explain to the patients how long they can expect before receiving their pathology results. Have in place procedures for routine follow-up of all biopsies. Don't have a patient waiting for days when results are available, but no one has looked them up or notified the referring physician or the patient themselves. Be sure that within your system you have a method for documentation of calling results to the patient's referring physician and or the patients themselves. We also provide phone numbers to the patients and instruct them that if they have not heard back from us or their physician within 2 working days, to feel free to call us in the event that we have not been able to reach them or their physicians with the results. This meeting need only take 5 or 10 minutes of your time. It is required, but more importantly, it will be greatly appreciated by your patients as they proceed with this anxiety-provoking procedure.